the question to that answer is yes, the funding that Alliance Healthcare Foundation would give you has to go directly to San Diego and or Imperial counties, but if you want to serve a broader range of communities and you've got leveraged funding for the others, we're happy to have that. In fact, that sounds like a very innovative approach.
Another question is, will Alliance help us in partnering with an outside agency?
Great question, and yes, in fact, we would be happy to do that. One of our board members referred to that as a type of matchmaking, and so we would be happy to introduce you to organizations that we know.
And it also sounds like there's a follow-on to the earlier question. So the nonprofit agency, this is the question. So the nonprofit agency must also partner with a San Diego agency, such as the San Diego District Attorney's Office?
Sure. What we're looking for is partnerships that show you've got some sort of connection to the San Diego community. And so the nonprofit doesn't have to be a local nonprofit, but someone in the partnership should be local to San Diego. And so the district attorney's office would be an interesting partner and welcome.
Another question came in that is, can we serve a subsection like adolescents only if they meet other criteria?
You can certainly serve a subsector like adolescents, and adolescents would fall into our category of children that we're interested in. So what you'll want to do is, going back to that triangle slide that we have, you want to make sure that you're covering at least one of the bullet points on each side of the triangle. And so we would welcome applications that focused on children or focused on adolescents, so long as they serve the other sides of the triangle and also, met the other criteria of the process.
Yeah, it goes back to Karma's earlier point about you can either serve a broad population or you can go deep within a specific population. Now I see that a number of you have your hands raised. I'm sorry, we're not using that functionality today. If you have questions, I would encourage you to ask your questions online and we will answer them. So we're going to put your hands down for now, and please do ask your questions as they come in, as you have them. Okay, we're going to move on to the application process itself.
Great. Thank you for all the interaction. The application process. I want to spend just a few minutes talking about the timeline and kind of the process that we've envisioned here at Alliance for our I-2 this summer, because it is a little bit different than the process we've used in the past. One of the most distinct differences from our past process, and it depends on how far back you go, but we are going to be using our online application system, which is available through our website and is hosted by the company called CyberGrants. We are going to use our online application process. We have a letter of intent, which you can see is due on June 28th. And that letter of intent is going, we're going to walk you through that in detail in a few minutes. Jennifer's going to walk you through that. But the letter of intent is going to give us sort of the initial concepts that you're interested in applying for the funding about. And what we'll do is we'll take a look at the letter of intents that come in, and then we will identify which ideas we think on an initial review fit what we're looking for. And for those that we think are a good fit from the letters of intent, we'll be inviting you to come forward with an in-person meeting. And so this is kind of a new step. It's a new step for us, and we're going to be we're probably going to be inviting about 8 agencies from the initial letters of intent to come forward, and we will be we'll notify you at the end of July that you've been selected, and we will ask you to attend an in-person meeting on August 5th, which we're calling our pitch meeting. I'll give you a little bit of detail on that in a minute. From that pitch meeting, we will select the couple of agencies that we think have, now that we know a little bit more of you from this in-person meeting, we're going to select a couple of agencies to come forward with a full proposal. And that full proposal will be due on September 3rd. We have a review process that's built in following the full proposal, and we plan to announce who our grantees are in the late fall or early winter. So what you can see here is sort of a funnel process, of course, where we will hopefully get a good number of letters of intent on June 28th. We'll review a smaller number of them at an in-person meeting, at a pitch meeting on August 5th. We will invite a smaller number to come forward with a full proposal that's due on September 3rd, and then by the end of calendar year 2010, we will be able to announce who our winner is. The online letter of intent that Jennifer will walk you through in a few minutes has 5 sections to it, and this is essentially to give you at a high level what we need to know about your idea so we can determine whether there is a good fit. Where you're going to give us the primary contact information, information about your organization, information about your leadership, details about the program, and then 10 qualifying questions. So for those of you that have been following along with us, we had a community meeting on May 3rd, and for those of you that were there and got the packet, there's 10 qualifying questions in that packet. That's the things you will need to answer at the, as you fill out the LOI. So the pitch meeting is something that we're very excited about, and this is something where we're going to give the agencies that submit the LOIs that we're interested in hearing more about an opportunity to come before us in person and tell us about their ideas. What we're going to do is we're going to set this up so it's a day-long meeting where people come in, and the ideas you'll have 15 minutes. If you're invited, you'll have 15 minutes to do a presentation. We'll give you 5 PowerPoint slides, up to 5 PowerPoint slides. You can have 1 or 2 people there in person, and you'll have 15 minutes of presentation and then 15 minutes of Q&A. One of the things we're doing as part of this process is convening what we're calling our Blue Ribbon Panel. And this is a group of nationally known experts and local leaders who are going to help us review the ideas that we get. And so at this in-person meeting, we'll have Alliance's board, our program committee, and these Blue Ribbon panelists to interact with the agencies that have come forward with ideas that we're interested in. The presentation, you might want to have it be done by the partner that is here local to San Diego, because we won't be able to cover travel expenses at this point in the process. But it should be a very interesting day, and from this meeting, we will identify who we would like to hear from in a full proposal process. Once again, it will be an online-based application, and the Blue Ribbon panelists, that's what BRP stands for, the Blue Ribbon panelists and the AHS board, all of the questions that came up for them during the course of the pitch meeting, if they didn't have a chance, or if you didn't have the opportunity to fully answer those questions, the proposal will be the place where we'll ask you to complete those. So that in terms of how we're going to go through our selection process, the letters of intent will be reviewed by the AHS staff. The pitch, the evaluation of that will be done by the program committee, our board, and our Blue Ribbon panelists. The final proposals will also be reviewed by the program committee and our Blue Ribbon panelists. And then it is Alliance Healthcare Foundation's board which will make the ultimate determination of who receives the grant, and that's our typical process. Just to give you a sense of what we're going to be scoring you on if you decide to apply through the LOI that's due on June 28th, here are the things that we're looking for. And really, this will be something that we'll be asking all of our reviewers, whether they're board members or Blue Ribbon panelists or the AHS staff, to take a look at is, does this project that you're proposing have the potential to profoundly improve access to health and health care for the underserved? Is there going to be an impact on the San Diego region that's meaningful? Are we going to move the needle in some way, really? What level of innovation are you bringing forward with this proposal? How does the partnership look in terms of constructing the group that you're proposing be the implementers? What's the use of technology like? Are you using technology as a strategic lever to really change the game for us, or is technology being used just kind of as an operational tool? Is the program scalable? In other words, is there the possibility that you start off in one neighborhood in San Diego and take this national, or that we start off in San Diego and Imperial County and this ultimately becomes